Lahish, thank you there. And yes, a very warm welcome, ladies and gentlemen, to our next session here at the Mohammed bin Rashid Knowledge Summit for 2023. Yes, my name is Laura Buckwell, and I'm absolutely delighted to be moderating our next session, where we're going to be taking a look at redefining wellness. Well, ladies and gentlemen, digital technologies really do have the potential to play a crucial role in improving health equity. And that's why our next set of guests are here, ladies and gentlemen, to get some critical thinking going around digital health solutions that improve urban well-being, the latest trends, as well as the relationship between digital health, smart homes, and wellness in general. And I'm absolutely delighted to be joined by such an esteemed group. We have a really fantastic speaker lineup ready for you here today. So let's get started. Well, ladies and gentlemen, before we move directly into our discussion, each of our guests now have about 10 minutes each for some opening statements, and they're now going to give us their unique perspectives on redefining wellness, what this means to them, and also what it means to their respective companies. So first and foremost, ladies and gentlemen, please do join me in welcoming for our first opening statement, Atif Al-Breiki, the Chief Information and Digital Officer at Dubai Academic Health Corporation. A very warm welcome.
Thank you. Assalamu alaikum. So my name is Atif Al-Breiki. I'm the Chief Digital Officer of Dubai Health, and I will talk more about Dubai Health. As some of you might not be fully aware about it, because we just launched our brand a couple of weeks ago. I'd like first also to thank Mohammed bin Rashid Knowledge Foundation for arranging the summit and for the invitation. So Dubai Health is a fully integrated academic health system. It was established by law 2 years ago when Dubai Academic Health Corporation as a legal entity was established with a very clear mission of advancing health and livelihood of people in Dubai through the integration of care, learning, and discovery and giving. And the principle of an academic health system is you integrate the care delivery setup, which is the typical hospitals, clinics, and centers, with the academic part, where the focus is on training the future caregiving workforce. The focus there also on advancing research in medicine and health science. And there are various ways of integrating that. So when people ask, why did Dubai take that move? Why did we establish Dubai Academic Health Corporation or Dubai Health? The basic principle is, if you look at the top health systems today in the world, they're all academic health systems, and the level of integrations differ. Some of them are fully integrated, like Mayo Clinic. They have a university, they have research centers, and they have the great hospitals where they treat people. And they have also a foundation, which is looking at the philanthropic mission of sustainability or financial sustainability. Or there is partnership between a university and an academic institute with a hospital like the Mass General Hospital and Harvard Medical School example. The brand of Dubai Health was launched 2 weeks ago with a tweet from His Highness the Crown Prince of Dubai, with the focus on our mission, which is to put the patient first. Our core value today as an organization is to put patient first in whatever decision we do in providing care, or even when we look at preventing diseases and driving population health program, which I'm going to cover in a few moments, to drive wellness within the community. We're a group of 6 hospitals with 26 ambulatory centers and 20 plus medical fitness centers. We have also Al Jalila Foundation, which is a foundation that's looking at endowment and focus on philanthropic initiatives in the field of care delivery, learning, and discovery. And Mohammed bin Rashid University of Medicine and Health Science, which is our academic arm of delivering our mission and learning mission. If you look at the bottom, our four core pillars are to provide care through our hospitals and the fully integrated facilities that we're running, learning, discovery, and giving. This is here our mission. Is the focus of integration is that together we'll be advancing health for humanity. And that is done through the delivery of our mission of impacting the lives and to shape the future of health of people through the integration of care, learning, discovery, and giving, with the initial focus on patient first. And that's, a patient is when someone is vulnerable, right? When someone is sick and requires care. The theme of the summit today is around wellness and how do you prevent people getting sick. So one of our key strategic goals is to drive population health programs. We know today that many things that are impacting the health of people are not typically the diseases. They are the social determinants of health. So your educational environment, your living environment, your housing environment, the weather that you are in. The obsessive use of technology, one of the themes of the session today, as we discussed, Laura, is around digital and technology. So these things are going to be affecting people. And how do you drive and avoid people having sick is through driving population health programs. And in the Emirates of Dubai, Riaya program was launched earlier this year to cater for elderly people and people of determination. And the aspiration of that program is very long. At the end, there will be collaboration with different government entities and with entities that are looking at social impact of people to make sure that we not only look at patients when they are sick, but in the future drive population health program that focuses on prevention and the well-being of people. And in general, since the theme here today, we're talking about technology, one of the biggest challenges of driving and providing care in the healthcare globally, and our region is no different, is the fragmentation of care, right? When you have initiatives where you need to make sure that you share medical records between people who are sick. In some countries, they face that challenge, and here in the region, alhamdulillah, recently there were few programs, and the Emirates of Dubai, we have NABAD program driven by Dubai Health Authority, which makes sure that medical records are smoothly integrated between facilities that are providing care. But if we look at wellness, those technology platforms in the future can even connect with entities that are providing social support or entities that are providing leisure support to make sure that we can drive prevention programs based on certain indicators and based on responsible sharing of information between these entities to drive wellness programs, to drive population health program, to drive prevention programs, to make sure people are always well and you avoid them having sick. However, if they get sick, there is always Dubai Health as an institution that is focusing on providing care to patients who are going to be most vulnerable at that time through the integration of the missions that I discussed at the beginning: care, learning, discovery, and giving. And the theme here is that that level of integration is going to be providing the best level of service that hopefully the population in Dubai will be able to achieve and receive from institutions here in the region. So with that will take me through the end of my initial talk. I'll be then joining the team in panel discussion and taking your questions, inshallah. Thank you.
Really fantastic overview there from the Dubai Academic Health Corporation. Asif Al-Abraki, thank you so much, covering your mission, vision, and values there, as well as some of the preventative measures taken and the action being taken as well, and that population health drive as well. So thank you so much. Really, really brilliant insights there. I would now like to welcome Parmjot Bains, the Gulf Cluster Country Manager at Pfizer, for her opening statement. Thank you.
Hello, everyone. Welcome. Great. So my talk is really around the future of health driven by digital transformation. So what we've seen is Deloitte, Ernst & Young, McKinsey, and a number of consulting firms have really turned the lens on the future of health. And there are incredible parallels amongst their reports, the most prominent of which being digital health will drive transformational change. The expectation is that prevention and early diagnosis will be the future of health, and that by 2040, the consumer, not the patient, will be at the center of the healthcare delivery model. I think we all saw that COVID really accelerated the digital disruption. It completely shattered any preconceived notion that we had around how or when digital would rewrite our healthcare models. Where it was a walk, we are now at a full sprint. Digital adoption is no longer business optional, it is a business imperative. The rise of digital has occurred across all global markets. It's not just a North American or a first world phenomenon. In fact, the ubiquity of smartphones and the almost universal access to internet has given emerging markets new opportunities to overcome healthcare inequities, including geographical and infrastructure challenges. 2/3 of the world have access to internet as of April this year, which is 5.18 billion people. According to Statistica, in 2023, the current number of smartphone users in the world today is 6.9 billion people, meaning 86% of the world's population owns a smartphone. So what is digital health? Digital can be a variety of things to many people, and I think that's where the nomenclature and standardization of definitions will start to become important. What I'll focus, it could be anything from, as you can see, health IT, but what I'll focus today is on digital health and medicines, which, in Pfizer, we've launched a digital health business unit that looks across all of these areas, digital biomarkers and endpoints within our research and development units, remote patient monitoring technologies, digital screening diagnosis, and digital interventions and digital therapeutics. The promise of digital medicines really has the potential to be game-changing, from improving health equity to empowering patients to redefining workflows and centralizing models of care to fill gaps in care, particularly in areas like mental health. When consumers and providers will have access to detailed information about their health, and consumers will play a central role in making decisions about their own health and well-being, there is a promise that real-time micro-interventions will enable us to get ahead of sickness and catastrophic disease. In addition, they can often deliver treatment more cheaply than traditional therapy by reducing demands on clinicians' time and at scale. Many of these interventions have essentially been created in the last 5 to 10 years, and there are many companies in this space as startups trying to find ways of delivering this innovation. In a lot of these cases, these interventions and treatments are likely to be more precise, less complex, less invasive, faster and cheaper than traditional care. Just having a look at across what we define as digital medicines. It comes from patient monitoring, as it sounds, devices that allow providers to monitor and analyze their patients' conditions from outside the clinical setting. Digital diagnostics, which are products that clinically diagnose disease and injury. Wellness apps, there's around 350,000 wellness apps available on app stores. Around 250 are released every day. Most are in the wellness space. This category doesn't make medical claims. There's no regulatory approval required. And in some cases, digital therapeutics, which is the item on the end, will often begin as a wellness app while the company collects clinical trial data and can often be confused with wellness apps. There's wearables, which is a digital product that is bundled with hardware to support a medical intervention. And finally, digital therapeutics, which I'll spend some time on the presentation and get into more detail on the next slide. So digital therapeutics, what is this? It's really effectively a health software that's intended to treat and alleviate a disease, disorder, condition, or injury by generating and delivering a medical intervention that has a demonstrable positive therapeutic impact on patient health. Often that will mean clinical trial data that validates that that intervention will make an impact. We see two segments of digital therapeutics emerging. The first consists of therapies that extend the value of traditional pharmaceutical treatments through companion software, providing adherence management or personalized treatment recommendation. That's the item on the left. On the right, we are starting to see the emergence of a second segment of therapies that could potentially replace traditional pharmaceuticals or even healthcare providers. Replacement therapies are clinically validated treatments for neurological or psychiatric conditions to be deployed on personal devices such as tablets or smartphones. The market is betting big on this area. The future of digital therapeutics has the potential to be enormous. And the technology and pharmaceutical companies are actively engaging in this space. When we look at the areas, it's a bit of a busy slide, but the areas in which clinical trial data is being developed and apps are being developed, you'll see a lot of it is around the areas of sleep, anxiety, behavior. But there are a number that are already on the market, and then a number in still development. One of the key challenges around this area is really the reimbursement framework. How do these get reimbursed as effectively as a medicine? Some countries in Europe have developed a framework, other countries are still coming to that. Finally, my closing thoughts on the future state. I think what we'll find is that consumers will be the owners of their data, determining how, where, and when they want to be cared for. We will need to include social and mental, in addition to the physical, will become the preference of the consumer versus a fragmented acute care model that we see today. I think going forward, new cost-effectiveness frameworks will need to incorporate the new value drivers. And finally, as I noted before, solving reimbursement challenge will be key. Thank you.
Fantastic opening statement there from Parmjot Bains, Gulf Cluster Country Manager at Pfizer there, and a great, impressive insight there into digital therapeutics, digital disruption, as well as the promise that digital medicines really do have for the future. So thank you so much. Right, next up, and rounding out our panel, it's our final opening statement. Please give a very warm welcome to Tika Salim, Vice President and Head of the MENA region at the International Well Building Institute. A very warm welcome.
Thank you so much. Just wait for the presentation. Great. Thank you so much. I think to the panelists before me, it was very, very insightful. What I will be talking today about is Delos, which is a company that is focused on health and well-being, and a company that is focusing on putting people first. We've existed for over a decade now, and our mission is to really make people healthy inside buildings. As I'm sure a lot of the people in the audience are familiar with the green building movement, and now since the UAE is gearing up for COP28, a lot of the conversation is around sustainability and environmental sustainability and the green building movement, which has been an amazing movement focusing on things like energy efficiency, water consumption, and things that buildings could do to save the environment. I like to simplify this because everything that we do is focused on people and their health and well-being and human sustainability. So those two things do not compete with each other. In fact, they complement each other. Because we believe that planetary health is dependent upon economic health, which is dependent on human health. If we don't have healthy people, we will not be able to achieve our goals to have a healthier planet. So at Delos, science has been in our DNA. We've been focusing on research and development, and we invest a lot of capital on research and really understanding how buildings impact people's health and well-being. And we do the research so that you don't have to. And just to give an example of that, I know that many people in the audience, and I've always received this question, like, which technology should I use? What air purifier is good? What type of lighting is good? And this is what our organization does, is that we look across all types of products and all types of solutions, and we understand what is good for people's health and well-being. We all remember the pandemic, which is not times that brings fun to anyone. But I believe that there were some positive outcomes from the pandemic. And I think one of the positive outcomes from the pandemic is that it made people understand the importance of indoor environments. It made people understand that what we touch matters, what we breathe matters, how we gather indoors matters, and that this is not an amenity, and it's actually a necessity. It really made people understand the importance of healthy buildings. We spend over 90% of our times indoors, whether that's our homes, our offices, our schools, our hotels. I have 2 kids, and we were just talking about this before the panel. I believe in this part of the world, we spend over 98% of the time indoors. When you look at some of the statistics that comes out of the authorities that says that 85% of the population has vitamin D deficiency, it shows you how much time we're spending inside. So as an organization, we've been focusing on finding solutions, technologies, standards that really have these buildings work for us and not against us. When you look at some of the statistics, over 75% of the causes of death in developed countries are caused by chronic disease. Chronic disease such as heart disease, diabetes, metabolic syndrome are all linked to stress. And guess what is the biggest source of stress? It's the workplace. And we know this because also the WHO put a price tag of $311 billion in 2019 that was spent on burnout globally. So as an organization, we have been focusing on finding solutions for this. Delos as an organization invested upwards of $150 million in developing the WELL building standard, which became the largest certification platform for healthy buildings around the world. And the WELL building standard is all about looking at everything within the built environment, things like air quality, water, lighting, acoustics, nourishment, and everything that is surrounding us right now, and how we can make these things work for us and not against us, and how we can make these things healthy. $150 million went into our research partners. We brought together the top medical institutions around the world, organizations like Mayo Clinic, Cleveland Clinic, Harvard School of Public Health, Columbia Medical School, and so many more medical institutions that informed the WELL building standard. The next group that we brought in were the major architecture, engineering, and construction firms like Gensler, HOK, and a lot of organizations that informed the WELL building standard. What we've learned from the research, which our colleagues here have kind of mentioned in their opening speech, is that your health outcomes, when you look at your health outcomes, and it's very surprising, 5% of that is caused by genetics. We cannot do anything about this, at least not yet. And about 10 to 25% is caused by lifestyle and medical care. And up to 70% is caused by social and environmental surroundings. So, ladies and gentlemen, the rooms that we're sitting in right now is impacting our health and well-being as we're sitting right now. The air that we're breathing, I do not know what type of filters are in this room, and I'm forced to breathe this air. The water that we'll be drinking, the lights that we're being exposed to through our circadian nerve, and everything that is surrounding us is impacting our respiratory health, cardiovascular health, immune health, cognitive health, and so many more health outcomes. So our mission has been to always put people first, and to really have these standards that are backed by science to help organizations do the right thing for their people. And it was the first time that there was a standard that was launched that was holistic. This is not about one department at an organization doing the right thing. This is about everyone coming together for, again, a shared mission and a shared vision for putting people first. It's about the policymakers, it's about the operations, the designers, everyone coming together to put people first. And it's really about giving organizations a tool to have a roadmap to mitigate record levels of stress and burnout, to attract and retain talent, to report on ESG, and to give organizations this roadmap, and again, to bring everyone within an organization, whether you are the chief sustainability officer, or you're the CEO, or the board of directors, really bringing everyone together to put people first. And we know that health is a journey. This is not a sprint, but rather a marathon. And this is where our organization have kind of put a lot of different programs where organizations can start somewhere and then build from that. You're celebrating work that is already in motion. So this is not competing with any of the organizations that you're familiar with. In fact, it complements this. And we're seeing a lot of different organizations that are now using well, global organizations that are using well to report on ESG, organizations like Citibank, Uber, Goldman Sachs, and so many more around the world. So everything that the International Wellbeing Institute focuses on is for people. But then Delos goes another step further, and we have actually founded a Well Living Lab, which is a founding collaboration between us and Mayo Clinic, where it is a full lab where we're able to actually move walls around the lab and understand how any type of intervention, how any type of product or technology is impacting us. So if tomorrow any of the manufacturers comes to us and says, I have a solution that I believe would help hospitals, or I have a solution that I believe would help hotels, we will put this in the lab. We are able to have and move walls. We have every sensor that anyone could dream of around these labs in collaboration with Mayo Clinic, which is actually, it's located on Mayo Clinic's campus in Rochester, Minnesota, and we're able to look at everything from temperature, humidity, filtration, ventilation, and everything, and we're able to come up with research papers and white papers to actually understand how these things are impacting people's health and well-being. One of the examples of that is a Stay Well program, where we have taken a lot of different products and technologies, like air purification, dawn simulation, circadian lighting, jet lag tool, and we looked at the guest journey and what exactly would they need while they're sitting and staying in a hotel. And we put this program inside a hotel to make these hotels healthier. Some examples, and some of the hotels that are doing this are like MGM Grand, Four Seasons, Marriott, and many more around the world. Another thing which is a lot of organizations are struggling with within the commercial space is that we know that sometimes employees at the middle of the day, they're tired. They don't want to work anymore. They're tired. They haven't slept the last night or any of the reasons. So we came up with the Mind Breaks program, which allows employees to actually shut off work, go and book a Mind Breaks room, and instead of having them sit in front of their laptop not being productive, let them go, meditate, and again, they are surrounded with a lot of health and wellness amenities, which helps them come back to work and be productive. Also your homes and how we can connect your residential homes and you spend the majority of your time inside your home. So we've been looking at technologies, products to really connect your entire home and to make you take informed decisions based on the readings that you're getting. We're working with a lot of different governments globally to monitor air quality across a whole city and really to start taking informed decisions based on what they are seeing as a part of their IAQ reading. So whether you look at a sector, whether PM 2.5 is high, PM 10 or TVOCs, et cetera, they're able to look at these monitors and they're able to work with us to actually make informed decision, versus just making decisions based on what they want. This is a very small snapshot of some of the clients that we work with globally. What I like about this snapshot is that not only that they work with us, they start somewhere, and we've seen organizations like JPMorgan Chase that have taken our Well Health Safety Rating and put it across 6,200 branches globally. Brookfield has taken the Well Health Safety Rating, put it across hundreds of millions of square feet globally, and it's exciting to see this movement continue every single day. My final few slides here, the UAE has been a leader within the global healthy building movement, and it is amazing to see organizations like the Prime Minister's Office, the Dubai Land Department, the Crown Prince's University, which is now teaching the Well AP course, Expo City, as they're gearing up. Actually, this press release that you see on the left-hand side, if you look at the date, I don't know, it might be a little bit, this came out yesterday. They were just celebrating their Well Health Safety Rating achievement. They are a Well community member. They are a member of IWBI, and they're doing so much to advance the healthy building movement. Dubai Police, and so many more, Majid Al Futtaim, and a lot of different organizations that are now a part of this journey. We actually now have 500 million square feet of organizations that are incorporating our programs here. Here's my final slide. As buildings are coming nicer and architectures are being more creative with their designs, let's not forget that the buildings where we live, work, learn, and relax profoundly impact our health and well-being. And I'll leave you with that. I thank you so much for your patience. This is a QR code of my personal LinkedIn. I would love to connect with everyone if you would like, of course. But I thank you for your patience, and I'm here. I'll be around in the panel to answer any questions you may have, and thank you so much.
A fascinating insight there on making people healthy inside of buildings, prioritizing people, of course, as well, and the true effects of social and environmental environments on our health, which we don't really think about, do we? So thank you very much for those brilliant insights there. Right, we now have about 20 minutes for a bit more of a discussion. Let's get sort of into some of the presentations and some of the facts that you've revealed to us here today, and expand on some of the topics there. So Atif, I'd like to start off with you, if I may. Sure. So really fantastic presentation there, talking about your mission, your vision, and your values, of course, as well. But in your experience and throughout the sort of time you've been in this sector, tell us a little bit more about the sort of key trends in digital health that you're seeing right now, and also, from telemedicine to virtual care to the latest health apps, which we heard was 150,000 health apps out there. Is that right? Yeah, 350,000, my goodness. I mean, there's so many to choose from. So what, as well, in terms of AI is such a hot topic. What impact is AI also having on the sector?
Thanks, Laura. So, if you look at the latest trends that's happening in digital and healthcare in general, digital and technology is key. It's definitely a key enabler to transform the model of care, the way that we provide care today. So if you look at the history of medicine and hospitals, and previously people were treated at their home, right, before the invention of a building hospital to achieve the economy of scale. And that model was driven by the need of population growing and unavailability of a mechanism to provide care at home. Now, with the advance of telecommunication, 5G, 6G, availability of optimized software and driven by AI, and availability of hardware. So everyone today has a couple of phones, has all the digital technology at home. You can take healthcare delivery back to home, and you can start provide. And today it's live that you can have a consultation visit through mobile phone. You can have medical devices so that you are getting remotely monitored for chronic condition progression using wearable device and the mobile, and advanced care at home or advanced hospital at home. So instead of a patient spending time at the hospital in an inpatient setup, that patient can be given the same level of treatment using digital technology at home. And there are already some hospitals already providing what they call hospital at home programs, so providing the same level of setup. Instead of a patient being moved to a different ward, the patient is moved to their home. They're still inpatient. They're still being treated as an inpatient facility patient, and providing the same level with the availability of the supply chain and the logistics and the technology enablement. You can provide the same level of care, and that has proven to be providing better health outcomes when the person is at home, providing better well-being environment for the patient. And AI also is a key enabler. So when it comes to prediction of diseases and driving population health programs, you can easily risk stratify the population to know who are at risk of certain diseases using AI models, and do early prevention program to make sure that that segment of the population doesn't get sick. There are today apps that you can upload certain images and predict if is the person having certain condition, and provide recommendation, or a diagnosis and a potential recommendation. The biggest challenge, I think, with AI is how do we ensure they are properly regulated? How do we ensure the safe use of AI, especially in an industry that is very critical and touching the lives of people like healthcare?
Absolutely fascinating. And I suppose that, obviously people are worried about AI, that they're going to take over jobs, and from everything that you said, they could potentially take over sort of professional doctors. However, the key to AI, I understand, is to work hand in hand with the professionals. Everything's got to work hand in hand, right?
Yeah, no, AI is not going to replace physicians or human. It's just going to be an enabler for us to provide better care and better services to people.
Make things faster, which is essential as well, isn't it? So,
Exactly,
yeah. Brilliant. Thank you so much. Right, moving back over to Parmjot. Fantastic presentation there, talking about the promise that digital medicines have, as well as digital therapeutics as well. So, as you mentioned, the future of healthcare is digital. I mean, that's a fact now. So, what are the primary sort of challenges and opportunities within the pharmaceutical industry in particular when it comes to adapting to digital health then?
Absolutely. So I think you've outlined it really well. I think the opportunities are enormous, and the opportunities are around putting the patient at the centre of the healthcare delivery model, right, and everything that we do. So all of these technologies are around the patient and giving the patient better access to healthcare, both in developed countries as well as in developing countries, resolving health inequities through a lot of these digital technologies. So we have apps here within the region, Ayudu, which is used as part of our patient support program that really enables a more seamless patient journey. I think the opportunities are very similar. Like key one, I think we will all face is data integrity and data privacy and patient data privacy. Just as an industry, for all of us, it's absolutely critical to maintain. I think when you've got 350,000 apps, how do you know which one to choose as a patient? So I think there the brand becomes important, but also the clinically validated data around the use of that app and the benefit of that app become important. So I think there's a lot of opportunities, but as we move forward, it's just making sure we go through the challenges. And then I guess one of the other ones which I mentioned as well is the reimbursement financial model, like the incentives for developers to create these apps and industry to create this technology. You need to make sure there's the appropriate ecosystem in order to roll that out.
Thank you so much. Moving back over to Tekka now, yet another very insightful presentation, something that we don't really all think about too much. But with 500 million square foot of projects registered to pursue well, that's across the MENA region alone, which is actually, quite incredible. How are you seeing organizations incorporate sort of wellness into their organizations as well as these sustainability practices as well?
Yeah, great. I think people are starting to realize that, again, planetary health, which is something that I just mentioned, the planetary health, is connected with human health. And we're seeing a lot of organizations that are actually now, using some technologies and some products and some solutions in their buildings that are helping them hit both, the sustainability aspect of things as well as the well-being aspect of their buildings. So if you look at some examples, we can look at lighting and energy efficient lighting. This could be circadian, good and circadian lighting that is good for the circadian rhythms of the people. The green building designs, which means and includes bringing in biophilia, bringing in indoor plants inside a building so that you can achieve these green building designs. One other thing which I think is important. Sustainable furniture. One of the things that we don't think about is the furniture that we have in our homes, our offices. These could really be toxic, and they could off-gas, TVOCs, and they could off-gas things that we don't want to breathe. So there is also the sustainable furniture that could also be healthy. So what we are seeing across a lot of different organizations in the region, and specifically in the UAE, is that organizations now are more aware of the importance of these things for their people, and they're just making more informed decisions. So as I said, to hit both sides, the environmental sustainability aspect as well as the human sustainability aspect.
Back over to Atif, let's talk about partnerships for a moment. So what sort of essential partnerships are needed to create this type of essential ecosystem? From startups and academia to future healthcare workers. Tell us about those partnerships.
Sure. So, typically if you look at academia, right, the focus is more on the theory and the evidence and the approach of doing things. But then if you look at entrepreneurship and startup, it's more about the practical use and how do you get things moving from theory to practice and use. And that partnership is very important to take those ideas from the theoretical part And also when it comes to entrepreneurship, you need also the academic evidence-based approach to give credibility and comfort to the end users when it comes to using new technologies that are introduced either to end users or especially in a facility, in an environment like healthcare. You need that evidence-based approach. So that partnership becomes very, very important. And specifically in healthcare setups where it's a fully integrated academic health system, you have an environment where you can provide the academic part, the research part, with the learning, so having students also being involved in ideating and co-designing new solutions. It gives you a mechanism of providing partnership with the industry, so the startups to come and collaborate with that arm, but also gives you the practical use of taking that innovation to a care delivery setup and even to the end users. So you have an ecosystem of patients that you can get in touch with and make sure that they're early involved in either trial of a new technology or maybe the practical use of that technology in an operational setup.
The essential partnerships there are very, very crucial to anything like this, of course. Now, when we think about the information revolution, Parmjot, how can the industry leverage these types of trends then, not only to address healthcare needs, but also, overall societal well-being?
Absolutely. I think there's a couple of key points on this one. One is just as an industry, we develop pharmaceuticals, and it's really anything that we can do to help ensure that those treatments are getting to the right patients, that patients are adherent and compliant, so we can actually address the acute disease state that we may be treating. Also helps our society, our healthcare providers, our healthcare partners, then better leverage resources around prevention in other areas. So I think that's one key area of focus. The other one is, as I've said, we are actually have a digital therapeutics business unit, which is actually looking at developing specific wellness apps with clinically validated data, so we can actually start to move and actually intervene around the areas of mental health and well-being. So actually look at societal well-being in that way. So I think as an industry, we're all there on that healthcare journey to really bring the patient at the centre of everything that we do.
Thank you so much. Teka, back over to you. Now, you mentioned you spoke a little bit about WELL in the UAE, so I wanted to focus on what the UAE government is doing in this regard and sort of what action they're taking as well.
Well, the government has played a crucial role in the expansion and the growth of the healthy building movement. As I mentioned, the first client that we had in the UAE was the UAE Prime Minister's office. But now what we're seeing from the governmental point of view, which is very interesting, and I think other governments around the world is looking at this as a model. We look at the Dubai Land Department, for instance. They've taken one of our programs called the Well Health Safety Rating, and they've incorporated as a part of the RERA ranking, and they're now incentivizing buildings that are doing these things. I mean, it took the Dubai Land Department a lot of time to really do their due diligence, understand the standard, know the added value for the organizations, but now they have incorporated as a part of the RERA ranking, and they're now incentivizing buildings for doing these things. From the education side of things, and also, Atif touched on that, but we work with organizations like the Crown Prince's University, for instance, Hamdan bin Mohammed Smart University, where they have achieved these programs, and Dr. Mansour Lawar, their president, was like, I'm very interested in this, and I want to see how we can expand this and expand the knowledge of WELL and the standard to everyone. And now, anyone in the UAE can actually go and study and learn the WELL AP course as a part of Hamdan bin Mohammed Smart University's curriculum. They are now developing a well-being course. And we're seeing so many governments, and a lot of different governmental organizations that are incorporating this and doing more of it. So it has been very, very exciting, and to really see the leadership of the government and how they have been, behind the healthy building movement, because at the end of the day, as I mentioned, it's something that is extremely important to put your people first.
Very, very, very exciting indeed, and what an incredible future ahead. So just in the last sort of 5 minutes or so, I actually just wanted to finish and sort of wrap up with your final sort of key message to our audience. Off the back of your presentations and our discussion, so much food for thought there. But what would you say is your sort of key takeaway? What would you like our audience to particularly remember from our discussion here today? Atif, why don't you go first?
I think two key messages, and I think you highlighted it in your presentation very well, which is health is beyond just the diseases and the care setup. It's really the social elements and well-being activities that really contribute a lot to keep people in good condition and to make sure that when they get sick, it reduces the impact of that disease. But also the other key message from digital perspective and being in the digital domain is that digital is just an enabler of a new way of operating. It's not that things are going to change because and initiatives should not be driven by, it's an exciting technology or it's a new. You need to really look at how can you change your business model, the way that you operate, and just have digital as a key enabler. And today in healthcare and in health delivery setup, I think it's a key opportunity for many health systems to really fully capitalize on these enablers in digital to transform the way that they provide care to patients.
Thanks so much. Parmjot, your key
Yes,
takeaway for us.
I think my key takeaway is digital, I agree, is an enabler that enables us all to be at the centre of our healthcare delivery model, right, and our healthcare journey and our future healthcare journey. And that the future is very exciting. There's a lot of opportunities, a lot of ideas coming through, a lot of technologies coming through. So just, I guess, watch this space.
Tika.
Yeah, I'd say my Tika. Okay, I would say my takeaway is really education. Educate yourself and get to know everything. Don't worry about technology and the pace that technology is moving with, and AI and all of this. This will work in our advantage and not against us. This will not replace humans, will never replace humans. That's just my take on it. Just educate yourself, get to know these technologies and see how they could help you be healthier and how they could impact your health and well-being. I just believe that education is key. And the more the technologies advances, that we should all be happy about this because it just gives us more resources and it opens up the source of knowledge that we have as individuals to be healthier and live the well-being lifestyle.
Well, as you said, a very, very exciting time for the healthcare sector. So much ambition, still a lot more to do, but it looks like we're getting there. And yes, thank you so much for getting us up to date on the latest in redefining wellness. Thank you so much for joining us. Ladies and gentlemen, let's hear it for our panel. Thank you.